This conference will now be recorded.
Hello, everyone. Thank you for joining Clinical Peptide Society webinar for April. It's Ask Your Questions to Dr. Lee and to Dr. Martinez. Hopefully, Dr. Martinez will be on the phone. Currently, his son is getting some type of religious event going on, so I'm not quite sure exactly what's going on, but he says hopefully he'll be free to come on to the webinar. But anyway, let me quickly read this disclaimer. This webinar is provided as a general guideline and for informational purpose only. The information is not intended to replace medical advice by other physicians. Readers and viewers are encouraged to confirm the information provided with other sources. Dr. Edwin Lee, Dr. Luis Martinez, Clinical Peptide Society, and the guest lecturer will not be liable for any direct or indirect damages from information provided. Some housekeeping notes. If you have any questions, then just type them into the webcast interface. Please silence your phone, and this meeting is recorded. So an update on the petition to save peptides. This is, I found really interesting. I don't go onto the website every day, but once a month I just take a look on some of the comments. And the one by Jennifer R. was really touching here. I have a son who was vaccine injured and has responded to peptide therapy. This therapy will help him become an independent adult instead of someone on Social Security disability. Save peptides so he can become a taxpayer one day and not a tax burden to society. So that's these stories are amazing. And then this other one here, right here, says because peptide therapy will be the next frontier in healthcare. I already think it already is. And we have up to 1,249 supporters, so please pass the message. It's very simple. You can go to clinicalpeptidesociety.com and just basically click on the petition and you fill in your information here, your first name, last name, email, and address, and this petition will go to your 2 senators and 1 representative. And if you type in some message, that'd be great. So please tell this to your patients and to your friends. So we are trying to raise money, and every dollar counts. And before you ask your questions, I just want to mention that there's a special for this webinar. It was actually mastermind workshop that Dr. Luis Martinez and I are holding. It's May 13th and 14th. And we do have a special price that we only have, by the way, 3 seats left. It's maximum 10 people. So anyway, it will sell out. Anyway, the special discount, $1,000 discount is BINGO, B-I-N-G-O. And it's going to be starting May 13th, Friday evening. I know Friday the 13th, and we'll have cocktails and dinner. It'll start 8 a.m. May 14th. You can look at on the itinerary, the agenda that's on CPS website for the agenda, but it'll be at the Westin Tampa Waterside Hotel. And we'll basically be, we're not going to have too many lectures, but there's a lot of questions and answers, but we'll be also touching about some interesting studies and some new lectures that you've never heard of. In addition, we'll talk about plasma dilution and the best stuff in terms of reducing biological aging. So if you want to learn more, we'll also do ultrasound guided injections. So it's going to be a lot of fun there. So I'm going to open it up to questions. Let's see if anyone has any questions. Let me see. Let's see. There's no one typed any questions. So dose semaglutide vial really only lasts for 28 days after opening. I feel like it's wasteful to dump after 4 weeks when so much is left. Oh, you know, Ozempic is basically the brand name for semaglutide. And as long as you keep it refrigerated, I've used it definitely just even beyond expiration date, and I think it's fine, it's safe. there's no, it's stable, and I've used it beyond the expiration date, and I think it's fine. But if you keep it at room temperature, it does expire faster, so keep it refrigerated. And I agree, it is a waste. But anyway, I do have people that it lasts, I tell them you get one vial and it will last about, if you use like, say, you're up to 1.25 milligrams, actually 0.125, and then you eventually get up to, actually 0.25 go to 0.5 milligrams. That vial could last you up to 20 weeks, so it'll be perfect. Anyway, so yeah, the compound pharmacy that I use for semaglutide B12 is actually from TaylorMade Compounding. So, all right. Does anyone else have any other questions? Let me give you your contact information for another. Let me first find her. And I found someplace where you can get thymosin alpha-1 that it doesn't burn. And she's from Pure Compound Pharmacy in Indiana. And her contact information, I'll write it down. Let's see. What comes out? Here we go. Message to everyone. Okay, so it's Linda Hayes, Hayes, 317. Don't text her now, text her tomorrow, the appropriate hours. 2677. She has thymosin alpha-1 and other peptides, but this one does not burn at all as compared to Brooksville. So I'm really happy with this. You can get TA1 from her. I don't know when, how long thymosin alpha-1 will still be available, but anyway, as of now, it's still available. So there's 2 compound pharmacies that I know of that has thymosin alpha-1. All right, so chat panel is attached. All right, so, all right, this may be our shortest webinar. If there's no other questions, it's designed to ask you questions. I just did get a text from Lewis, and he says he's hopefully going to get on shortly. He'll join in as mute. He's still at church. But all right. Can you use Humira with thymosin? Interesting. That's a really interesting question. I've never used Humira. It's an immune modulator, and thymosin actually naturally stimulates your own immune system. I think they probably shouldn't use it together. It's either one or the other. But we've had people who failed basically biologics, and they've done very well thymosin alpha-1. So I know my nurse practitioner, Becky, she sees very complicated patients with Crohn's disease, ulcerative colitis, has been on many different biologics. And anyway, she does extensive testing. And anyway, these patients respond really well with peptides. And yeah, it's also with Remicade and thymosin alpha-1, I wouldn't use it together. But what does peptide IGF-1 do? That's a really interesting thing. I know some patients, some doctors and providers use IGF-1. It's supposed to, instead of using HGH therapy, human growth hormone, or growth hormone releasing peptides to increase IGF-1, you basically use IGF-1 to at the end product. But I can tell you my experience with IGF-1. I know everyone has a different experience, but I was really involved with the first batch of IGF-1 many, many years ago. And we did a lot of testing to see if we can increase their IGF-1 levels. So we would get a baseline and check and monitor it. And we used multiple different dosing. And my receptionist would enter all the data, and at the very end, she goes, "Doc, I don't think this is working." And you could see that it's, basically everything's flatlined. So if your receptionist is entering the data and you also confirm, the data is correct there, I just have not seen any improvement with increasing IGF-1. So it's IGF-1, I consider the active growth hormone. And anyway, I think we tested over 20 patients of different ages, different dosing, and I don't think we went high enough. I think it's cost prohibitive, but I mean, I stopped using it, but I'm sure other people have, and maybe they have different results. I did type in the pharmacy there, so let me type it in for the, it's called Pure Pharmacy, and they're in Indiana, and the contact information is Linda Hayes. So let me give you, let's see, the phone number again. Maybe it didn't go through. So her name's Linda Hayes, 317-771-2677. So put a dash here, send. All right. All right. Any peptides that help a patient with bowel strictures? Hey, Russell. So you could try BPC 157. It may help, but when you have adhesions, I think it's you probably have to surgically correct it. So you could try BPC 157. I think I saw some animal studies and with BPC 157, but anyway, I can't remember if there was bowel strictures that they looked at, but they looked a lot with inflammatory bowel disease and all that. All right, so hey Becky, so she wanted to ask about ARA290, and she thinks, can you talk about ARA290, as I think it's the best kept secret? Well, Rebecca has been using a lot of thymosin alpha-1 for this autoimmune pain that she would have affecting her entire body, and she was using tons of thymosin alpha-1. And then when the FDA says, hey, we're going to take away thymosin alpha-1, I told Becky, hey, you got to try something different. So let's try ARA290. So ARA290 is really an amazing peptide. It's like erythropoietin, but it doesn't have the side effects of erythropoietin. Erythropoietin has been shown to help with neuropathic pain, and it activates a certain receptor, the native repair receptor. And this only gets expressed if you have severe pain. So the problem with erythropoietin is it can cause increase in hemoglobin, hematocrit, thicken the blood, and you can have erythrocytosis, and your blood pressure can go up. So there's some unwanted side effects with that. So they designed a peptide that acts on that receptor, but it doesn't cause the side effects of increasing hemoglobin, hematocrit, and other side effects. So it has really helped with neuropathic pain. You could give it injections, 1 to 2 milligrams sub-Q for about 28 days until the vial is done. And then just take a break, and you can repeat it maybe in a month or 2 or 3 months. Some people can go 6 months out, and their pain has significantly reduced. Some people, they do 1 round, and they're pain-free. I've used it IV intravenously, and I have some patients who say it works much better than just sub-Q. So ARA290 is a miracle peptide, especially for neuropathic pain. I think this is really interesting. All right, any peptides for MS? MS is, I've been wanting to see some patients with MS. I don't have many patients with MS, but I would do senolytic therapies to reduce the bad cells in their body, and you could do dasatinib and quercetin. And I do have some patients with Parkinson's who noticed that has made a big difference. But then after reducing senescence, you could actually try some regenerative peptides like dihexa, BPC-157, thymosin beta-4 for nerve conduction. And hopefully they'll get better that way. I just haven't seen a lot of MS. Some of the patients that have MS, they're kind of married to their neurologist, and they're afraid that if they do anything experimental, they cannot be involved in any future studies and through conventional medicine. So I don't think any conventional medicine is really remarkable, like Alzheimer's drugs. I know Big Pharma spent about $66 billion to reduce amyloid, but it's missing the whole target. So it's completely failed. They're not looking at basically a functional medicine approach. All right, so any peptides to help with cardiovascular benefit, especially with aortic stenosis? I don't know. I don't know about that one. I don't have many patients with severe aortic stenosis that way. Usually by that time, they probably already got their valve replaced or fixed or something like that. But top of my head, I don't know. Maybe there is, but you know, it's like a question like, what's the peptide for prostate? I can't find any. So I haven't looked for peptides for aortic stenosis, but all right. Let me ask, let's go for another one. Mixed connective tissue disease, used one, yes. 1 year ago, no pain since then. Oh yeah, so my nurse practitioner had mixed connective tissue disease and severe discomfort. She's been pain-free for a year after using one round of ARA-290, which is amazing. It doesn't help with every type of pain. I have some diabetics who say it definitely has significantly helped. I have patients with autoimmune condition, and that it has significantly helped, but they have to use it every 2 or 3 months. Big difference. But there's some people that go, I've tried it and still have it. So I'm not quite sure exactly what pain they have, but I have something down the road that we're going to be talking about at the mastermind meeting that it's going to be really exciting. I'm really excited about it. So I think that's going to make a big difference. Question, what peptides would benefit with lung atelectasis? Well, lung atelectasis is a collapse of the lung, so it's really improving on lung function. And honestly, it's like you go to the hospital, I remember, like, they're post-op the patient, and they would get the incentive spirometer, and they would have to kind of blow into that little plastic device and trying to get their number up. And I have people that, FYI, that they've had chemotherapy and they have really weak lungs, and when they do the incentive spirometry, it's like 500. It's really minimal. I mean, if you're really young and healthy, you can go 5 liters. And in 2 weeks, less than 2 weeks, using a product, it's not a peptide, but it's really a precursor of NAD, NMN, like Nancy, Michael, Nancy. It's a nicotine. It's a precursor of NAD, the nicotinamide mononucleotide, and using basically 500 milligrams. She actually used only 250 milligrams, and then really she went up to basically from 500 to 1,000. So she's going to come back, and she's going to be tested with 500 milligrams, and I suspect she'll get up to 1 gram of NMN, and it's really practicing trying to get the lungs deeper and to get the diaphragm working well. It's really exercise that's the best thing to basically get the lung diaphragm working, but also using things to increase mitochondrial function. So whether you use a product that's like NMN, or maybe a mitochondrial peptide like MOTS-c, or basically a product that's oxaloacetate. So it's basically the first step with acetyl-CoA combining with oxaloacetate to make basically citrate. You can basically help with that Krebs cycle, and it's a muscle, so it needs basically better mitochondrial function. So exercise, increasing mitochondrial function should help with lung atelectasis. All right, here's another question. Dementia patients other than dihexa anywhere to get cerebrolysin. I actually stopped using cerebrolysin. I loved it initially, but it is really a biologic. It comes from a young pig's brain, and there's a lot of things we don't know about cerebrolysin, what exactly it's in it, which peptides in it, and there's other growth factors in there. So, and the question is, are there prion? It's coming from a brain. So I kind of stopped using cerebrolysin. And I don't know where to get cerebrolysin, but anyway, at the back of my mind, it's that prion disease, so that's why I kind of avoided that. Let's see. There's a question about, I have not used TB frag, but I think I'm not 100% sure, but you can look at Promise Pharmacy. I think they may have it. I may be wrong on that, but maybe Wells Pharmacy has it, and then Shields Pharmacy, Brooksville Pharmacy, I think has that, and also we'll check out Pure. So maybe there's another one that I heard, Southlake. I have not used that yet, but I hear they're in Tampa. They have a lot of peptides there too. So anyway, I ordered cerebrolysin from Australia in October, still not here. Good luck. They do have an expiration, so by the time you get it, you probably have to throw it away. It's beyond its expiration date. So that's the problem ordering overseas because of the shipment problem. So I ordered a bicycle part, and it's a simple seat post, and it was almost a year before I got it. It was like, I would call the bike shop every week, and after a while, anyway, they called me, like, I totally forgot that I ordered it, but it finally came. All right. Oh, Lewis is online. Good. But he is on mute. All right. So let's see. Some great questions here. Let's see. I'm glad there's a lot of questions asked there. So this has been really exciting. And if you want to get thymosin alpha 1, check out the Pure Pharmacy in Indiana. It does not burn. And like, I've been using thymosin alpha 1 for a while. And I remember injecting my wife and my kids, and they go, "Ow, this burns." And it's like, "What are you talking about? Just, man up." And then one day I was and I was having dinner, and this guy basically had a history of COVID, and he was coughing like crazy, and he goes, "I'm PCR negative." It's like, "Oh, I think you still have COVID." And he's literally, we're just like sitting, the table was really narrow, and after we talked, I just went back to the hotel room, and I injected thymosin alpha 1, 50 units, and oh, did it burn. So I was like, whoops, yeah, it does. This one from Brooksville did burn. All right. There's a question here. Maybe Lewis can type this question. Well, okay. Can Lewis answer this question? Why does Wells Pharmacy is the only one that has naltrexone pellets? You have to pay them $200 per month membership. So if you could text in, that'd be great. Lewis, I have no idea. And then this question is really for Lewis about, do you have a quick protocol for stage 4 colon cancer? I don't know about that. But let's see. Lewis, in regards to the question of the $200 per month membership, I guess it's because of volume. costs associated to testing, etc. Yeah, it does cost money to test and to make sure it's sterile and there's no microorganisms and to check for bioavailability. And so there is a lot of money involved in terms of testing. If you don't use a lot, I guess it does cost money. So let's see. Peptides for pulmonary fibrosis. I don't know of anything that's basically that can dissolve fibrosis, but I think perhaps reducing senescence, because that's what happens as we age. Things get fibrotic and everything just basically gets old. And so I would do, instead of peptides, I would do some senolytic therapy. The best published one is dasatinib and quercetin. And the protocol that I did, and that hopefully I'll get published data, is dasatinib 50 milligrams 3 days in a row with quercetin 500 milligrams. So you can get dasatinib at TaylorMade Compounding. If you get dasatinib 30-day supply at Walgreens with a good RX card, it's about $14,000. So it's cost prohibitive because it's a tyrosine kinase inhibitor, but it can be compounded. And you got to be careful with dasatinib because you can't, there's some interaction with certain drugs. So instead of 100 milligrams, they use 50. And they did a study with dasatinib and quercetin with people with idiopathic pulmonary fibrosis. And there is no therapy except for lung transplants. And they gave this group of people these senolytics because it's a perfect storm for basically the modeling of basically cytokines, inflammation, fibrosis. And they noticed that these people, they had less shortness of breath, they were able to move better, they had better walking distance. So functionally, they improved with the senolytic therapy. I don't think using any peptides will help. They're at end stage where you have to basically reduce senescence. So that's a key function. All right. Collagenase may help with idiopathic pulmonary fibrosis. FOXO4 is also a senolytic agent, but not much human data on it, but that's somewhat exciting there. And TB4 has some evidence against fibrosis. Well, okay. So thanks for chipping in. Also, melatonin. All right, so Chris here is basically an expert in bee venom, and he gave a webinar in December of 2021. And anyway, okay. For pulmonary fibrosis, high doses of proteolytic enzymes such as thermaxin from US Enzymes. Okay, cool. Everyone has some experience with that. But you can do that, and also senolytics. I think they will also help. And I think improving mitochondrial function, maybe with MOTS-C or measuring NAD levels and trying to get it up and to a higher level, I think will definitely help the lung function get better. Usually when they're very sick with pulmonary fibrosis, everything's falling apart. They have low NAD levels, mitochondrial dysfunctions, and basically it's just tons of cytokines, and it's a perfect storm where they develop fibrosis. So the senolytics I use, I'll just type it in. Dasatinib, 50 milligrams with quercetin, 500 milligrams, 3 days in a row per month. But these people, you can probably do, twice, 2 times a month if they're very sick. So you can do, because I have a patient that has neurodegenerative disease with Parkinson's, and I've increased his senolytic therapy twice a month, and he says that has made an improvement. He's noticed getting better that way. So yes, and we will discuss other senolytic protocols, really exciting, at the mastermind class. Any harm in using MOTS-c long term? I think that MOTS-c, it's just going to be too expensive, and it does burn for some people. I stopped using it because of injecting sub-Q. It's just the burn was really bad, and I loved it, but then it just got worse in terms of the pain. So I prefer just, instead of using MOTS-c, I've been using the product to increase NAD, NMN, and I think that's really good. You could use SS31, which is a peptide to help prevent the mitochondrial breakdown, but I've experienced that and haven't really felt the big difference versus the MOTS-c. I thought the MOTS-c, I do IV pushes of the MOTS-c, and that really makes a big difference. I just cannot do sub-Q injections. But in terms of use of the MOTS-c long term, I just think that people they will stop because of the burning. And that's the experience that I get. They just say, I can't stand it anymore. Oh, so there's a MOTS-c that doesn't burn. Okay, cool. I'll try out Pure Pharmacy. Thanks. All right. So cool. This is all learning, because I have experience with a lot of compound pharmacies, but not all, and I'm starting to use Pure. So really excited to try the MOTS-c there. All right. So, all right. Let's see if I missed any other questions. Louis, can you do a quick type in for quick protocol for stage 4 colon cancer with, that's advanced. I don't even see that. So I actually just asked Dr. Mark Rosenberg invited him for a CPS webinar, just update on like early diagnosis and treatment of cancer, how he does it. And anyway, he has taught the functional medicine approach to cancer for A4M for years. And anyway, hopefully he'll accept the invite. And I know he's super busy, but any patients that have cancer, I refer Dr. Mark Rosenberg. He's in South Florida, and he's phenomenal. So, all right. Quick protocol, metenkephalin 15 milligrams IV weekly with thymosin alpha-1 3.2 milligrams 3 times a week. And he uses GHK copper IV 2 milligrams 2 times a week. All right, so there you go. For stage 4 colon cancer with peptides, he uses 3. I know GHK copper reduces expression of the genetic expressions of cancer, but stage 4 usually they have their own mind, and the book I'm currently reading is The Emperor of All Maladies: The History of Cancer, and what they did in the 1800s is so barbaric. I mean, reading the stories, it's just like, thank God you don't live in that time. There was a president, I forgot, he got shot, and it wasn't Abraham Lincoln, and he got shot in the back, and it was a simple bullet that lodged in the back muscle, and but the thing was, the surgeon that came to try to extract it, they didn't believe in sterile technique, and basically this scalpel he used basically was in horse feces, and they just took it out, dropped on the ground, and just opened it up. So he just had so many abscesses, and they would dig in more, and it was just dirt. It just got worse and worse and worse. So the guy went to trial, and the famous line goes, "I shot the president, but I didn't kill him. The doctors did." So it was a true story. So anyway, yes, Mark Rosenberg in South Florida let's see, also doing autologous platelet and tumor lysate for antigen induction. Okay. So yes, Luis Martinez is expert for cancer, and question to Luis Martinez: GHK copper 2 milligrams, is that IV or I guess IM injection? Sub-Q. So, all right, sub-Q injection. Heather Sullivan. All right, Luis, you're up. Quick protocol for metastatic prostate cancer. I'm surprised you guys are seeing very difficult cases with advanced cancer. Unfortunate Mark Rosenberg is just down the road there. So I actually had a new consult this afternoon, and I called the patient this morning, and I told her not to come because I did help one patient with stage 4 renal failure who was on dialysis, and he got off the dialysis, and we used epithalin and used some other supplements, and he got better. And he got off the kidney, well, actually off the dialysis, and he never got on dialysis, but off the kidney transplant list. And then, so their friend wanted to come see me, but also stage 4 kidney failure. But it was from, she has a polycystic kidney disease, which is a genetic disorder. And they basically produce a lot of vasopressin, which causes the cysts in the kidneys, and the kidneys grow and grow and grow and get super big. It just kills their cortex, and they get the end stage kidney failure. So she needs gene therapy, and there's no gene therapy for that. But I told her about a medication that I remember studying the endocrine boards because of SIADH, and it's basically a vasopressin blocker. It's called tolvaptan. And I mentioned that she should talk to her nephrologist to get on that, because that can slow down the kidney function. And it has made a big difference for people with PCOS. But anyway, so here's the answer. Quick protocol for metastatic prostate cancer, similar to colon, but use laser. P as in Paul, D as in dog, T as in Tom. Intra in the prostate. So laser into the prostate. So that's okay. What peptides were you using to get patients off the kidney transplant list? Oh, I used epithalin, EPITHALON. And anyway, I'd like to do a study on that. We'll be looking at plasma dilutions as adjuvant therapy for cancer. All right, so more to come. I think this is evolving science with peptides and phenylytics and plasma dilution and other agents to basically help our patients. So it's not all peptides. It's, peptides, it's great, but not one thing will fix everything. What is the frequency of epithalin? Basically, I use 9 shots and 5 milligrams each shot, so it's a total of 45 milligrams, and repeat twice a year. And in the Russian study, they use basically 50 milligrams, and then they repeat every 6 months. They did it for 3 years, and they did a 20-year follow-up, and the people who got epithalin lived longer. They had less heart disease, less cancer, and less stroke. I did talk to Dr. Cavison, who discovered epithalin, and I asked him, can you use it more than 3 years? And he goes, yes, my 90-year-old mother in Chicago has been using it for 30 plus years. So it's basically helps your cell cycle in terms, it's like a reset button. So there's a Hayflick effect where our cells will stop dividing, whereas epithalin kind of resets it, so you kind of have a 20, percent more cell cycle. So and somehow it helps the kidneys and the back of the eyes with epithalin. Is the 10 milligrams for 10 days okay? That's 100 milligrams, I guess, for epithalin. That's a high dose, maybe 100 milligrams, 50 milligrams. Actually, maybe you should do for 5 days, and because the studies in Russia that was translated in English they used 50 milligrams. Now, I have used epithalin instead of twice a year. I've used it sometimes every 3 months, and for some of my neurodegenerative diseases, and if they can afford it, for other conditions, and they seem to be doing fine. I just don't know if 100 milligrams is, I don't know what the limit is on epithalin, because everything was typed in Russian, so it's hard to figure out. Not much was translated. Can you use for dementia? I imagine you're talking about epithalin. Maybe I think the studies has to be seen, but I think honestly, listening to Dr. Dale Bredesen, it's really interesting on how he reverses dementia, and he actually uses a functional medicine approach, and he basically shown people with MRIs with a shrunken hippocampus and neurocognitive testing, and then 1 year later that their hippocampus that was shrunken got back to normal size, and their neurocognitive testing got better. He does not use peptides. He uses more of a functional medicine approach, get the hormones balanced, nutritional. But the nutritional thing is interesting. He uses a company called Intellex DNA, which actually looks at 1,000 SNPs in your brain and also in your metabolism. So they're trying to optimize your pathways. And he basically, uses probably 10 to 15 supplements, and sometimes uses 1,000, and has made big difference. So anyway, I don't know what hometic concern means. I don't know what hometic means. Sorry. I can translate for you. Oh, Russian? Oh, that's fantastic. Yes, that'd be great. No, hometic concerns at that dose. All right. So, all right, we had a great meeting. It's a little past bedtime for me. So anyway, let me just mention about upcoming the webinars. And again, we do have the mastermind class. We have $1,000 off. So if you type in the word bingo, instead of 3,000 to 2,000, you'll get a great deal. And the hotel will expire April 25th. So it's going soon. So anyway, hopefully you can make it. We have 3 seats left. And the next 3 webinars, this is really interesting. Dr. Dushyant Viswanathan is expert in basically he does feces transplant, and he's basically and he does peptides. So he's going to be talking about longevity microbiomes. Again, in June 2022, we'll talk about questions on peptides and nuts and bolts with David Bonfa, and I'm trying to get Dr. Mark Rosenberg on CPS webinar. No promise, but I'm trying, and it's not easy to get speakers. But anyway, thank you, everyone. We had a great time, and so fantastic. Do I do anything? Okay, I'll see you at the mastermind then, and that's fantastic. So, all right, hopefully I'll see more people there, and thank you, everyone. Have a good night, and all right, see you next time. Bye now.
Okay.